I want to, anyone who can hear me, I want to ask people to mute themselves as we're getting you logged in. Please mute yourselves and make sure you turn off any background noise that's in your house.
Linda, I'm going to mute everybody. You'll have to unmute yourself probably.
Okay, all right.
Linda, unmute yourself.
Oh, I did. I did. Oh, Wayne's blinds. That's what you're talking about, Hal? Okay. Let me see if that works. Yeah, I can see him now, except maybe flip them the other way. Wayne, can you flip your blinds the other way? Make them go up a little bit. Let's try that.
Put some light on your face.
Oh, that's better. That's better.
And you're muted, Wayne.
Okay. All right. All right.
And now I'm unmuted.
Oh, there you are. Okay, nice to see you. How are you feeling better today?
Yeah.
Good, good, good. Got Sheila is there.
Is it muted?
Hi, Sheila. Yeah, we're letting everybody in right now, Sheila.
They can hear you?
Yes, I can hear you.
It sometimes takes us a couple minutes after 7 to get everybody in. Somebody is not muted, making a lot of noise.
That was my wife.
Oh, okay. Okay.
She's done making noise.
Oh, okay.
Our ice maker is very loud.
All right.
Quiet.
You be quiet over.
Oh, Dan Lack's going to get on with us. Hey, Dan. Hey, Dan. Mr. Lander, Mark, the president of the On Top of the World Democratic Club is on with us right now, Dan Lack.
That's nice.
Hi, Jim Carroll. How you doing? Okay.
Sheila, is your friend joining us tonight?
No, I left a message on their phone. They never got back to me, so no.
Okay.
Okay. Well, nice
Maybe
to see you,
next
Sheila.
time. I'll tell her to watch the newsletter, that's all,
Okay.
if I see her. My next door neighbor.
Hello,
John
Sharon
and
River
Nikki.
here.
John and
Hi.
Nikki. Hello. Hi, Irvin Sharon.
Hiya.
So who else, how many folks do we have on here tonight?
Well, we haven't, probably not everybody who's coming will be here. I'm going to expect somewhere maybe between 15 and 25. We never have exactly the same amount of people. We've got, just this is for Mark Lander's interest, we have about 54 or 55 paid up official members. And Carol Lee's here. Hi, Carol Lee.
Carolee.
And there's
I'll see her.
okay, I'm gonna wait till 2 or 3 minutes after 7 and then I'll just start the meeting, guys. Just see if a couple other people want to get in here. Okay, once again, I'll ask people to mute themselves, and when you want to speak, then you can unmute, or Gary will unmute you. Okay, I'm gonna wait another minute and then we'll get started. I don't remember.
I guess 7:01 now.
Yeah, I don't remember if Jim Houlihan said he was gonna be out of town or something, but oh yeah, he did, maybe. No, I don't know. Okay,
I didn't hear that he wouldn't be here tonight.
me either.
Anyway, just a couple of quick announcements. As Linda has indicated, please keep yourself muted unless you really have something to contribute or want to ask a question or something. If you're muted, you can press down the space bar on your computer and that unmutes you, and press the space bar again to mute yourself again. And I have the ability to I kind of control the master mute. If somebody's playing a I don't know, television in the background or got a dog barking or something, I can try and figure out who that is and mute people, but we'll leave you up to doing that yourself, if you will, please. And the meeting is being recorded. We will post it up onto YouTube after the meeting is over, generally within a couple of days, so that anybody who is not able to join us here tonight can catch on to what our speaker had to say and what else is going on in the club. And with that, I'm going to let one more party in here, and Linda, turn it over to you.
Okay. All right. Well, I do not see anybody that I don't recognize, so I don't have new visitors, except of course Mark Landers, who's our speaker tonight, which I will be introducing him shortly. He's here with us. And I see Darlene's getting in now. That's good. Our secretary will be taking your names down, and I just want to confirm how, if you can see everybody's name, shake your head. Okay, good. All right, good. So we'll have our attendance for tonight. Okay, we got a special occasion to do tonight that I don't know how many of you already knew about it. We have our former, is he still here? Yes, Wayne. Our former president, Wayne Mamie, is on with us. And we, the board, and the other members wanted to recognize Wayne for his past service to the club. And so I'm going to say right now that on behalf of the club and all of our members, and in recognition, Wayne, for your service to our club, as well as to the Marion County Democratic Party and your extraordinary support of Democratic candidates and other humanitarian organizations. Now, I apologize. This might not be a perfect picture, and Wayne, I'm going to bring this to you tomorrow, okay, since we're not together in person. We're going to present you with this certificate. And I don't know how well you can see this, guys.
I can see it well.
And everybody can see it okay? This is for Wayne, because we're just so proud of him for being such a good president to our organization. And we just wanted to give him a little something special. Wayne, were you able to see it okay? Everybody give Wayne a hand. Okay. And so Wayne, I just wanted to know if you wanted to say a couple of words.
Well, thank you. I'm honored. Just a heads up and a warning to everybody else. Make sure you think twice before you volunteer for a position.
Oh, come on now. You mean it wasn't the most fun thing you've ever done?
I am just joking. It was an honor. It was an honor and a privilege to do that, and had so much fun at our rallies and sign waving, and especially with the other groups on the other side of the street. That was a lot of fun and very interesting. And Linda, you always provided some quality entertainment with some of those other party people. It was always fun.
You gotta watch it. You gotta watch it. We are being recorded.
But yeah, it was an honor, and I certainly recommend it. And I want to thank everybody for the honor that you're placing on me with that certificate. Thank you.
We just wanted to show you how much we appreciated you, Wayne. So thank you very much for being our president.
I give you full credit for getting Biden elected. Full credit.
Oh,
thank you.
Yes, of course. That's it.
I'll accept that, Gary. Thank you.
Single-handedly.
All right.
Thank you, everyone.
Okay. Well, Wayne, are you going to be able to stay with us? And if you are, great.
I'm feeling pretty good right now and today, and I'm gonna stay. Yeah, I'll stay on.
Okay. All right. Well, then, without further ado, I'm going to introduce our speaker this evening, who is Mark Lander. And if I get your title wrong, forgive me, Mark. The Interim Deputy Secretary for the County Health Systems in Marion County.
You've combined both of my titles. What a lot of people don't realize is I'm actually wearing two hats right now.
Okay. All right. Well, thank you.
Yes, I am the Interim Deputy Secretary for County Health Systems, which means I oversee all 67 county health departments.
Woo.
But that's just been a short-term gig. I've been doing that about 7 months. But I split time between Tallahassee and Marion County, where I'm the administrator, and I've been the administrator since 2017.
Okay, well, thank you for that clarification. I also wanted to just point out to our members that you also are the president of the Florida Association of County Health Officers. And Mark holds a Bachelor of Science in Food and Natural Resource Economics and a Master of Science in Soil and Water Science. And right now, I'd just like to thank you so much for being with us, and I'll give you the platform.
I appreciate the opportunity to speak and talk a little bit about COVID. I mean, it seems I've talked a lot about COVID over the past year and a half. A little bit of my background is, as Ms. Linda was saying, that I do have my undergraduate degree, both undergraduate and graduate degrees from the University of Florida, with my secondary degree based on contamination, public health effects. I am an administrator for the health department, which means I'm not medical, but I do have a lot of great medical professionals that work for me, including our medical director. So a lot of times I may get a medical question that I'm comfortable answering through experience. If not, I will take a written question and I will submit it back to your organization so everyone can have the answer they were looking for after I've had my medical director or nursing director review them. I do have, I guess I started off a talk the other day, and I started it by saying I'm in year 31 of public health. I've been doing this since 1989. And I'd asked, there was about 20, 25 people in the room, and I'd asked for a show of hands, how many people ever thought we would see something to this magnitude, understanding that, yeah, we've had, H1N1, and then we had the Hong Kong flu back in 68, 69. But no one really raised the hand, and we never really thought we would see this. And then I also asked the question, well, how many of you believe from what we've seen happen that we've actually been preparing for this since 2008, 2009? I got a few laughs because it's understandable. We've seen so much misinformation, disinformation, and sometimes it even looks disorganized. But the understanding is there's been a basis for all this that health departments have been working on for years. And it's just, it's interesting the way this worked out. I was joking with somebody the other day. We've been doing this about a year and a half. I said, I've been in the field 31 years. It only took me 30 years to earn my pay, and when we have something like this going on. But what I'm going to do for you all is I was submitted a list of some of the questions that you want answered. If I don't answer those in the middle of a talk, or certainly remind me at the end. I tried to take the majority of that information and combine it into a PowerPoint, similar to the one that I give the county every 2 weeks. So I'm going to go to screen share here, and let me know when you all see a screen that says Department of Health, Marion County COVID-19 trends.
Yes, I
Yep.
see it.
We got it.
See it?
All right, great. So I'll go ahead and I'll get started. There again, if you see something you need to interrupt me during the talk, please feel free. Or if you want to wait till afterwards and ask questions, I'm good with whatever works for you all. I was going to start off. Let's talk a little bit about cases in Marion County. Get this thing rolling here. Maybe. Come on. Let me try this one more time. Get it logged in. All right. Did it switch to weekly positive cases?
Yes,
Okay, great. What we do at the Marion County Health Department is we track our weekly cases to see where we are, ranging from week to week, look at different spikes, things that may occur that cause an increase in cases. You're actually looking at, this is about a little bit over a week old data. We prepare this every 2 weeks. We'll be doing a new positive case slide for next Monday. But what I can tell you is you can see our trending. We really spiked up at about 1,900 cases in that 1 week in January. And then we saw that trend reducing down to about mid-February, where it started to spike again. And then we had spring break. And then you could see that spring break, that was when it was down to 222 cases in that week. And then it slowly started transitioning back up. 2 weeks ago, we were at 475 cases per week, or during that week. And the good news is just last week, we've dropped down to 326. So we've seen a decrease in our weekly cases. Now, for total cases since the beginning of this, back in March of 2020, Marion County has experienced 31,405 cases, and that's as of yesterday. And we've been seeing an average, if you look at it, of about 400 to 500 cases, over the previous 3 week period, and now starting to decline, which is very good news. Going on, looking at our testing samples per week, you can see in Marion County, we average about 6,500 tests a week. Last week, for instance, our testing trend is a little down. We're not seeing as many tests coming in per week as we did. It was about 5,800. But the good news with that is, if you look at our next slide, positivity rates. Typically, as your number of samples go down, your positivity rates typically decline. Well, we were at 7% a week and a half ago. Last week, we were at 6.7, and this week we've already started off at 4%, about 4.4%. So we're starting to see our positivity rates drop down slightly there. Here, hold on 1 second. I need to do something here real quick while we're on. All right. So looking at those positivity rates, that's one of the things that we compare. We look at the number of cases per 100,000 per week, and we also look at that positivity rate. You'll hear terms and definitions. When it first started, you heard a term. There was community. You had community transmission, but you basically also it was like what's our community? There was like a community rate or community spread. You might have heard both those terms: community spread, community transmission. Community spread is just a general term when you start finding out you're getting cases and you cannot tie them back to a specific where they may have occurred, whether it was a family infection or if there was a facility infection, like at a nursing home or at a correctional facility, something like that, or even a business. When it first started, Marion County, we started seeing our cases back in March of last year and into April, but we weren't having what we call community spread, because every one of the cases we were tying back into a travel related case, an in-house contact. So we knew where the spread was coming from. It was not out in the community. Then that slowly started to change, especially when you got through some of the first holidays in May and then into July. It really started getting more difficult to track where cases were coming from. But what we do know is community transmission, and that's where community transmission is broken into low, moderate, substantial, and high. And that's a gauge that we use within our community to determine where we are. Like when we take a look at, are we at low, moderate, substantial, or high? We base it on the number of cases per 100,000 and a positivity rate. It's kind of a combination factor. And to let you know, right now in Marion County, where in several months ago we were at what was considered high transmission, we are now down to what's called substantial transmission. So we're starting to reduce based on what we see with our positivity rate. And there's a chance it could reduce even more with our positivity rate now dropping below. If it remains below 5%, that puts us in more of a moderate transmission, which would be nice. And we go to the next slide. One of the, we had the focus, and when our president was focusing so much on, we need to get these vaccines out, starting, in late January and into February, making sure we could get more supply into the county health departments into each state. We really focused on that 65 plus population, because when you look at the way it, the major impacts, and I'll show a slide here in a minute, with mortality and hospitalizations, it's our senior population that has the worst outcomes with regards to this case or this virus. And I point out, if you look at the left of this side, that's the dates aren't on the bottom, but on the far left, that's where we were in 65 plus COVID cases around the start of the summer, or 65 and up COVID cases. And you look, we were averaging about anywhere from 100 to 200 a week over the summer months in our senior population with infections. And then you look at the second spike, that red line is December 30th. So you can see that second spike was in the middle of our Thanksgiving and our Christmas holidays. At the end of the Christmas holiday, we really started seeing a spike to where in 1 week we had 450 senior infections in 1 week. And then you can kind of notice that red line was the start of our vaccinations. And we saw, we would typically expect to see a decrease in cases even without vaccination. But what I like to point to everyone is, look at what we call the slope to the left. You have over on the left-hand side, there's a real gradual slope where when we hit that bottom, before we started getting a couple more, a rise in cases. Oop, let me go back, hold on. There we go. But what's important to notice the slope on this after the December cases. Very sharp, very severe. And we're maintaining these cases now in our senior population of well below 50 per week, which is nice. That's what I would love to have it at 0, and that's what we're shooting for. We're seeing those numbers continue to decrease, but that's one of the positives that we feel you have to look at what have vaccinations done for our community. So that is a specific area that we continue to monitor. I wanted to show that point I was talking about earlier. We talked about our 65 and up population. And this is some information that's pulled out of daily reports that are run for all the counties. And you can see in Marion County that while, in our infection age groups, you look at our 85 plus population, we had 975 total cases in that population. But the high number of hospitalizations and unfortunately our high number of deaths that have occurred in this population, 31% of those individuals have required hospitalization. And over 30%, unfortunately, it ended up in a mortality. So you can see, and that numbers typically drops down. You can see going to the age 65 to 84, or 65 to 74, 75 to 84, how it increases in age. And then looking at the hospitalization piece, you can see the increase from the 65 up. But then also looking at the increase in hospitalizations in that 0 to 4, that's understandable because you think about it, our less immune individuals are going to be, of course, the infants, as well as our senior population. They would be most vulnerable to the virus and for hospitalizations. So I think that's really gives a clear picture of why the rollout was done the way it was, focusing on senior population and then gradually trending down as more vaccines became available. So it was a concept of protect the most vulnerable. And it's also, this age group is also the largest age group that we would see that would take vaccinations and that would accept the vaccination. We vaccinated almost 70% of all of our population our senior population in Marion County. And in our younger populations, which typically are the more spreader population, they don't vaccinate quite as much. So I'll talk about some things that we're doing to try to make it more available to get into those community or those populations as well.
Can I ask you, Mark, go back to that slide for a second, please?
Absolutely.
I noticed between the age 25 and 64,
Mhm.
the number of cases are in the 4,000s.
Absolutely.
I think you've already touched on one of the causes. Those people are younger and maybe they're not getting vaccinated as much as the older people. But how else do you account for those numbers in the 4,000s for that range, 25 to up to 64? Is that other?
Typically a more social, and I mean that from the fact larger social gatherings, larger social events, more compact. A lot of spread we saw over last summer was in that age group. Ended up being, you were looking at when we opened the bars and they opened the bars back up. A lot of people, you may think, well, we don't have that big a scene in Marion County. Well, what we were finding, we have a large group in that 25 to really 54 age group that goes to Orlando, that goes to Gainesville. And you could say what you want, but Gainesville, even with all their ordinances were in place, the bars still had availability of people in them. So we were getting a lot of infections that we would trace back. The majority of them were coming from the Orlando area, even Tampa, but even Gainesville as well. We were getting in that age group, getting spread. It's also typically an age group. I will mention this because this is a problem even today when we do our contact tracing. You have an age group that may not be as severely impacted from a sickness, sore throats, runny nose, and even with all the guidance that we've given, stay at home when you're sick. If you've been exposed, be tested. It's not uncommon today to trace back several cases in a location to one person who's been at work sick for 3 or 4 days, taking whatever medications to feel better and going into work. So that's another reason. If you look at that age group, like I said, the type of events they typically are associated with, as well as not less severity and infection, and going to work and going out sick, and it leads to those infections in those age groups. So,
and just to follow up with that, are you going to touch on how hospital personnel were infected? Do you have any data on that?
I don't have any data right now on that. I mean, I could definitely pull that data and get it for you. The good news is we've seen hospital infection rates with regards to workers dramatically decrease. And that even started decreasing before, when this first started, there was issues with some getting the proper PPE, protective equipment in, masks, gowns. And so you saw a lot of hospital infections occurring that. And I will be honest with you, we had some occurring where you had individuals who were going to work. They just felt like they needed to be there. Doctors and other individuals, they just felt like they needed to be there to treat. And next thing you know, there'd be 4 or 5 others that were being infected and taken out at the same time. Of course, what's really helped with that was when we opened up vaccines to our senior population, they were also opened up to frontline healthcare workers too. So those doctors.
I have a question for you.
Absolutely.
With the pronouncement from the president today that masks are no longer required and everything seems to be stabilized, how is your data relating to that, and what are we looking for with relation to what you're proposing?
Well, how that's what the president has said. Our Surgeon General. I was talking about this with Miss Linda before we started. Our Surgeon General had came out last week and made that announcement, knowing that the CDC was going this direction through a health advisory, that masking was no longer required if you're fully vaccinated. And I heard the president say today, meaning if it's a 2-dose vaccine, you've had both doses and it's been 14 days since your last dose. Really what the expectation may be, and this is I will tell you, whereas there's no data to make a scientific judgment on this at this point, but there will be, trust me, there will be plenty of data. But in Marion County, we've seen infections, what we call like a breakthrough infection. An individual may have been vaccinated, and even in our senior population in our nursing homes, and they may test positive, but the severity of symptoms is greatly reduced. No hospitalizations are required. So I think, what we could possibly see is if we're going unmasked, which is what the president has said, and you're fully vaccinated, you may see some individuals that might be exposed. But the evidence so far is showing these vaccines are providing extreme protection, not only avoid or eliminating infections, but also reducing severity of infections in the event you were to become infected. So I think we need to just continue to monitor. We'll continue to monitor our infection rates, such as the daily percent positives and infections per 100,000. And that's what we continue to monitor when we look at what we're doing as mitigation practices in the community. Any more questions on this data?
No, not from me.
All right. Next, we do look at hospital trending data. Dr. Singer, our medical director, puts this data together. There are several things that we look at because, we talked about masking, and one of the importance of the mitigation measures was to make sure that we don't overwhelm our hospital systems. And I mean, there's been a lot of misinformation out there with even locally about the hospitals are full. Yes, there's certain wards have been full or wings have been full, but they never had to activate what we would call an emergency plan. And what hurt is in the middle of all this, the hospital changed some reporting data. Like overnight, we saw beds drop from 37 beds to 2 because ACA had asked the hospitals to stop reporting your bed availability and report your bed availability based on your staff that you have on hand, not taking into account they can bring in more staff. So that was one of the things that changed. But I think if you look here, we're looking at hospital admissions. You can see back in July, we had the first spike over summer and then that second holiday spike. There are 3 lines here. There's an orange line, which is a 7-day moving average, a gray line, which is a 30-day moving average, and a yellowish line that is a 90-day moving average. We pay close attention. Of course, you're looking at the 7-day average. It gives you an idea of what's going on over the last 7 days. But we really follow that 30-day trending average and then the 90-day. That gives you an overall picture of what's been occurring over, of course, a period of time. And you can see in this case, the 7-day averages for hospital admissions, it spikes, it goes up and down rather severe locations. But then you start look at the 30-day and the 90-day. The 30-day has started to gradually cap, would slow down, and the 90-day is still declining. So we want those 3 numbers to continue to, especially the 30-day and the 90-day, to continually decrease, because that doesn't take into consideration if you have a 1-day short spike or not. That 30-day average will start to slow down, and the slope will continue to decline. So looking at hospital admissions over the past, it looks like back into March, early March, we're seeing it steady with the 7-day, except for one little blip there. But the 30-day and 90-day are on continual declines, or the slope is starting to get to 0. We also look at what we call our medical surge bed data. These are just regular hospital beds where they brought in COVID positive. You can see the 30 days really starting to flatten out. The 7-day is stabilizing with number of these cases per day, and the 90-day trend is dropping. But what's really encouraging, and again, as we see vaccines go up, we have less severity. Look at our ICU numbers. Our ICU numbers are continuing. Over the 7-day average have really dropped. And it looks like we had a short spike in that 30-day average based on some of the infections after the spring break. And that's starting to decline back, and our 90-day is still continuing. So we're seeing less ICU cases, so less severity of infection. And then looking at combined ventilator usage, we've seen a drastic drop off in the last week or so with in the last 14 days with ventilator usage, again indicating that we're getting less severe infections over a short term, and hopefully see that gray line start to trend downwards, as well as the yellow line 30-day case. And then looking at well, they had one slide, they must have taken it out, which was it was a average of admits versus discharges, and we're constantly remaining in the negative case with admits on discharges on our 7-day, 30-day, and 90-day averages. I think I checked last night, we had 35 cases in our hospital system that were COVID positive, which included ICU and med surg. So that number back in January, and even some into February, we were up around the 120 range of individuals that were in our hospitals that were, and that would be over our 3 hospital systems that were COVID positive. So we've seen those numbers steadily decline as vaccinations have increased. Talking about vaccinations, let's go look a little on here. As you know, in the approved vaccines right now in Florida are Pfizer, Moderna, and then Johnson & Johnson. You'll hear a little bit about the different vaccines. We have Pfizer as our main supply at the health department. We can certainly get Moderna if we need to, but we also have Johnson & Johnson. You know, Johnson & Johnson being the 1-shot vaccine, with Moderna and Pfizer being a 2-dose. The Johnson & Johnson is still limited supply. It's available at the federal sites across the state, as well as some of our private, our providers like Walgreens, even Walmart. They may carry it. We tell individuals, reach out to them singly to find out what they're carrying. And we've actually started providing this at the mall site. The difference you talk about, and you'll hear, the 2-shot to 1-shot, remembering that both Pfizer and Moderna are what we call mRNA, or their messenger ribonucleic acid vaccines, a relatively new, I'd say in the past 10 years, concept that we've looked at as a way to produce a vaccine, whereas the Johnson & Johnson is a more traditional, what we call viral vector. And with a viral vector vaccine, they use a harmless vaccine, or in the case of the Johnson & Johnson COVID vaccine, it's a deactivated, it's not a live virus, it's a deactivated adenovirus, which is a common cold. But it acts as the delivery system. The body recognizes this when it is injected, and it creates an immune response to fight off any future COVID-19 infections. The antibody response, it looks for the spike proteins that are associated with COVID-19. So if you get infected down the road, it'll recognize what those spike proteins are, and then that's when it kicks into your immune system kicks in. Advantage to these types of viruses, or these types of vaccines, these viruses, the adenovirus specifically doesn't replicate in the body. In other words, once it's in there, the virus is in there, your body recognizes it, there's antibody response, it eliminates that viral vector, and it is gone from the body. Benefits of the viral vector vaccines, they provide a really good protection against serious consequences. We've all heard that with the Johnson & Johnson, with those who may get infected and get infected with COVID, and where they actually, the virus will replicate, it replicates, and the body does a very good job of fighting it down to where symptoms are lessened. Now, the Pfizer and Moderna, you'll hear the term mRNA. That's the easiest way to say it. The mRNA is a molecule, and it provides genetic instructions to the cells, whereas the viral vector gets into the cell, works for that tries to replicate the cell's response there. The difference with this is that, like I said, the viral vectors penetrate the cell. mRNAs rely upon what they call, it's a non-direct cellular fusion with the outside of the cell. So there's no interaction inside the cell with that vaccine. You have heard, I'm sure, with Johnson & Johnson, there was the vaccine-induced thrombotic symptoms, what we call VIT. It's a combination of low platelet counts that occur with blood clots, occurring in about 1 in every 1 million cases it's had. Guidance, we give anybody wanting Johnson & Johnson, we give them guidance prior to vaccination that if these symptoms occur, see your healthcare provider. And remember, the vaccine, they put it on hold several weeks ago. It wasn't on hold for a specific health safety concern with the vaccine. It was put on hold to allow for provider education. If somebody has had the Johnson & Johnson and they're experiencing these symptoms, this is how you treat it, because normal treatments for blood thinning and clotting issues, it was not working with regards to certain medications. So they wanted to ensure that they had all the information for the providers before they move forward. So I mean, that's a little bit about the approved vaccines that we have in Marion. Just to, talk about the vaccination priorities, we, effective April 5th of this year, that's when they went down to 18 plus for Moderna and Johnson & Johnson. And then Pfizer was 18 plus, but then as effective today, yesterday, the CDC approved it for 12 plus with parental consent, being from 12 to ages 17. So individuals who are that age can now be vaccinated at around the state of Florida, but with Pfizer vaccine only, not Moderna or Johnson & Johnson. But don't be surprised if the Moderna follows suit, since they're very similar vaccines.
Mark,
Yes.
may I just, I don't want to hold you up too much here, but
No.
could you please, because of all the misinformation about the blood clotting, I know you're probably a numbers guy based on your job and your degrees. Can you give us a concrete comparison about what those types of clots occur in the general population without any vaccine at all, or what happened with the vaccine?
I will have my medical provider give you that answer, because he is a very statistics guy as well. And those are the things he looked at. I couldn't give you that exact number right now, but I know it's out there, because that's when you have to look at it. What is the risk benefit of a vaccine if the chances of clotting is lower than it is with other vaccines that may occur, or other treatments that may occur? So I will provide that information out to you, and we'll give you something back in writing on that.
I'll share it with the members.
Absolutely. I mean, it's a fantastic question, because that's what we start looking at when we look at health safety.
Okay, thank you.
Just in Marion County, some vaccination statistics. Since we started vaccinating at the end of December, we've got 139,000, this is as of yesterday, 656 Marion County residents vaccinated. With the vaccine clinics going on today, I'm pretty sure that number will drop to over 140,000 by tomorrow, or it'll increase to 140,000. What that equates out to, because some of these doses or vaccines or some of these residents are giving dual vaccines. Right now, we've given over 248,000, almost 249,000 vaccines in Marion County. 115,000 of those individuals, a little over, are complete with our series, and 24,625 have received at least one dose of the vaccine. What's very important is I know I referenced it earlier. As of yesterday, we've had almost 76,000, we had 75,674 of our senior population vaccinated, which equates to 69%. Our goal was to have it 70% by June 1st. We feel comfortable that we will have no problem getting that number, specifically with some of the extra vaccinations that we're doing outside of the mall setting. Vaccine rollout, our mall site will actually be closing May 27th. And we've seen a huge reduction in vaccines out of that mall site, where when we first started back in January, we were doing 6,000 a week, 3,000 new, 3,000 second doses. And that was not including where we may have been running special weekend events outside of the mall. Now we're seeing anywhere from probably 300 to 500 a week. It's really dropped down. Right now we're giving first doses that started on the 10th. Any first dose that's received that's a Johnson or that is a Pfizer, they'll be bringing back to the health department, because starting June 1st, we'll be operating a 2-day clinic at the health department. One day will be first doses, one day will be second doses. But what that allows us to do is it allows us to look at different rollouts. And currently right now, this month, we've been doing business vaccinations. We've gone to some of our largest providers, our largest business companies in Marion County, and tried to provide, whatever for their staff that would like to be vaccinated. And what this does is this really opens up that 18 to 54 population who may not have been able to get out during the day and be vaccinated, but want to be vaccinated. So we started with the big businesses. And the reason we're doing those in June is we still have a company that's here until May 28th. Or the reason we started, in May with the bigger businesses is we have a company that's with us till the end of the month that helps us do these different missions, either on the weekend or during the week when we're not vaccinating at the mall. When they go, we retract our size a little bit, and now we'll be doing some of our smaller businesses. We've gotten requests of those businesses that have 8 to 10 employees. We're starting on those and be hitting those heavily in June. with our local vaccination teams that we're putting together and going into those sites. So we want to make sure that, you know, we certainly don't want to go out. If we've got a business that has one or two individuals, we'll go to that site, but we want to group it when we have other vaccinations close by, because remember, these are multi-dose vials, and every vaccine is precious. We've done everything we can to eliminate the amount of waste that occurs. If you puncture a vial, and we puncture a vial of of Pfizer, we know we have 6 doses in that vial. We want to make sure we have 6 individuals ready to be vaccinated before we puncture that vial, so we don't waste any doses. Some of the other things that we're doing is we have a long-term care mission that's going on right now. We partner with Marion County Fire Rescue and Ocala Fire Rescue. They're going back in. We had groups earlier in the year go back in and vaccinate our nursing homes, but they always get new individuals in and new employees. So we have a list of 50 some odd long-term care facilities, and we roll back in with those, bring in Marion County Fire Rescue. They'll vaccinate any new employees or any employees that want to be vaccinated, and any new residents that need vaccinations as well. We also do homebound missions. We have the Marion County Fire Rescue will be picking this up right now. We've had a focus point at the group that's been helping us at the mall. They've been doing homebound and homebound veterans missions. So we've been working on that. But Marion County Fire Rescue and Ocala Fire Rescue will pick that up in June as we continue along with both of those vaccination efforts. We've approached our schools. There's some conversation looking at summer school about the potential of vaccinating any of that 12 plus population. The parents would like their children vaccinated, going out to the schools to try to lessen the burden on the parents to have to try to take off time to come in. So to provide those vaccines as well. We talked about mitigation measures, and this goes back to the masking question that you asked earlier. You know, you're fully masked. There's no, you know, with what we know about the vaccine and the protection it offers, you do not need to, I mean, fully vaccinated, you do not need to be masked. But mitigation measures, you know, if you're not fully vaccinated, we are still recommending the practice safe social distancing at all times in stores. Outdoor spaces, you know, there again, avoid the crowded gatherings where you're shoulder to shoulder. Try to give yourself some space. If you cannot social distance, you know, make sure that you're in a facial covering if you're in those larger crowds. The important thing that we also talk about with mitigation and still continue to focus on is stay home if you're sick. You know, if you're sick, don't go to work, school, shopping, social events. Be cautious when you're near our vulnerable population. Unfortunately, we saw this happen in July. That was when we had a large nursing home outbreaks occurring. What was happening is we were having nursing home employees going to work because you think about it, we weren't having visitations at that point yet. The virus was being introduced in the nursing homes, and when you would trace it back, you could trace it back. There were several cases of workers that may have been sick, taking it inside of the home itself. So I think that was a huge concern. You know, when or if you're a caregiver for a parent. For years, you know, up until recently, my wife and her sister were caregivers to their 88-year-old mother. And so they were very cautious as a caregiver. Washing hands frequently, and of course, dealing back with the social distancing, we always promote the 3 C's, you know, avoid crowds, close spaces, and close contact. Some registrations, if individuals are still looking to get registered right now at the mall for the remainder of this month, on the Mondays that we're open, the hours that we're open, which I believe is 3 to 6:30, individuals can just walk up, no appointments needed. But if they want to make an appointment, easier to schedule for them.
Can I ask a question?
Yes, sir.
On your the nursing home issue with employees, are you able to, as a county health, as a Florida Health Department, are you able to mandate that each individual nursing home guarantee the employees time off if they come down with any COVID related, and that they feel comfortable? Because obviously people are going into work, yes, because they love their job and they're trying to help people, but maybe some people are going in because they're scared of losing their jobs.
As the health department, no, we're not able to regulate that. But when we did get those complaints, we turn those over to the Agency for Healthcare Administration. They're the regulatory authority over nursing homes. So we would get that complaint, and when we would get a complaint like that, we would file it with AHCA, and then AHCA would do a follow-up investigation. So we have, that's the bad thing, is we have no regulatory authority in nursing homes. That all boils back to Agency for Healthcare Administration.
Didn't the I won't get into other things, but that, and then are the employees, you're saying you're going into nursing homes, also are the employees mandated to get the vaccines?
The employees are not mandated to get the vaccines, but there again, that would be, it is a decision they would have to make. Now, there's certain masking requirements that AHCA has in place. Once again, I would defer that back to the Agency for Healthcare, but they are not mandated to be vaccinated, but we certainly offer it to anyone and everyone that wants to be vaccinated. But there were concerns that we would receive a complaint from an individual saying, yeah, I was told I have to be at work. All right, we get the name and number. We would refer them to AHCA, but at the same time, we would also forward that complaint to AHCA for them to follow up through the inspection process. Many times involving us going back out, we would go into a nursing home, and we would go in like I said, not as a regulatory agent because we don't have authority, but we would go provide guidance. We could provide certain guidance. We might walk into a nursing home and see improper mask usage. We would give the guidance and then immediately contact AHCA and do a joint investigation with AHCA when we would find issues like that.
One last question on the nursing homes. Have you seen in your 30-year career a change in the health department's ability to go in and do something lessened by our Governor DeSantis, for example? Have you seen any that you can actually say, like, did the Democratic governor provide more
I'll
to
be
the
honest
state health department?
I'll be honest with you, and I've been through both Democratic and Republican governors in my position. Our impact we've not been impacted, because when we go in and we see something, we try to, number one, if we have regulatory authority, we deal with it on the local level. If not, then we get it to those agencies. So we continue, with us, it doesn't matter, the office, we have our responsibilities that are in regulation. I haven't seen those regulations on my side lessened over the years. We've got our, certain inspections change, like it may go from this agency to this agency. And what we do that is we try to use our best experience that we have and interact with those agencies to make sure there's nothing falling between the gaps. Great question, but yeah, we interact a lot with different agencies, all of them.
I give you and the health department credit for the job you're doing. I'm married to a retired community health nurse for the Pennsylvania Health Department.
Okay.
And so I've lived that, and I've seen the how the government, how higher authorities can dictate what you can do yourself, and especially your lower, right, your nursing and the other people.
I think the nice thing at the local level is our mindset is we've got a job to get done. We focus on what we have to do. And I'm sure your wife can tell you that.
Yes. Same thing.
Yeah, same thing. You focus on the job at hand and getting it done. And you put every resource that you have, and even resources that you have to make up, you put them in there and get the job done. So,
well, thank you for answering the question. And I hope you get some more, I hope you get extra teeth to go after those nursing home employees, though. Thank you.
That's why what we try to do is we try to, and it's been, it's been a task. When we first started, it was really, we were calling the nursing homes daily, and then daily saying, do you have any new infections? Do you have any new cases? And then you just got a lot of information where someone may be on the phone responding back, oh no, we're fine. And then you go to find out there were 3 or 4 cases. And by that time, you're behind the 8 ball. So you really have to jump forward and move forward and get everyone in. And unfortunately, it could lead to some outbreaks. And we saw quite a few of our nursing home outbreaks as well as our prison system and corrections. We saw some of those as well. So,
Thank you for being so candid.
absolutely. But if you know of anyone that needs to be vaccinated, one with more comfortable with an appointment, this slide right here, which I'll share this information back with you, Ms. Linda, on the website and the phone number. They can call this number for an appointment. And we are pulling from multiple lists. I think everyone was aware when we first started our list, we had 50,000 people register in a matter of 6 days. It was truly, I'd say truly a nightmare, but I would not change it for the simple fact we were able to put people in line. And while some people were not happy, they were much happier hearing, look, it's going to be 4 weeks, 3-4 weeks before, or 5 weeks before we have vaccine to hit this number, than to have people waiting in long lines hours at a time and being turned away. That was one of the reasons why we never went to just a drive up. So we did drive ups by appointment, but we never just said, everyone show up and we'll vaccinate you, because we saw what was happening around the state and in other areas where you would hear the horror stories of, I waited in line 6 hours, got up and was told to come back tomorrow. And we didn't feel like that was very fair to not only our senior population, but anybody else wanting to be vaccinated. So that's, that we stuck with our registration system, and then have since introduced 2 more. One of them was the state system that we never use. We take the names from it and roll it into ours, which is now this tinyurl.com /Marion COVID Vax. The individuals can go there to get registered. They can call our health department number. The 2590 is our COVID health department number, and tell an individual, look, I'd like to get registered for my appointment. They'll ask them some questions and get them scheduled at a time. And there's so many places in Marion County where you can now find the vaccine, whether it's at a Publix, our federally qualified health centers, and so many of our other providers. We've actually provided vaccine to some of our doctors' offices, and we'll start providing to pediatricians to handle this 12 plus population as we proceed further. And then we also have this is the Homebound Vaccine at em.myflorida.com. I will give this number, but I will tell everybody in June 1st, this is changing. We're taking it back over at the local level because this goes up to the state. The state will assign some of the homebounds back down. We're moving it into the Department of Health as opposed to the Department of Emergency Management. So we'll be taking it back over June 1st, and we'll have a different number, or the different numbers to call and contact for individuals that want to get, that are homebound, have no way to get in to get a vaccine. That way we can assure that they get vaccinated as well. With that said, I'm sure you guys are probably tired of hearing me ramble on, but I'd be happy to take, Wayne, I was gonna also give you one more piece of advice. It's, don't ever, be careful what you're volunteering for, but also never walk out of the room right before they nominate and vote. You want to be
correct.
That's a good one.
Correct, Mark.
Yeah, I've been elected for half those things that were on that bio that I got elected for. I think I had walked out right before the nomination process. So, but all right, well, I know you guys have a busy schedule, but I'll be happy to answer any questions, or if I can't answer it, get back with you on data, because I'm going to get you that one question about comparison and clotting in COVID vaccine compared to natural clotting.
Okay.
I have a question.
Absolutely.
You had a slide that showed that 69% of Marion County residents 65 and over have been vaccinated.
Yes, sir.
Can you break that down by zip code?
I do not have the zip code data. That's not, I mean, there's been that question of going on in the state because some counties were breaking down by zip code. The problem that we look at with zip code data is there's some zip codes that split county lines. I think from our end, we take a look at, we know our bigger populations where like I said, the majority we've held the events. We try to focus and give every opportunity, every zip code an opportunity for vaccination. What I mean by that is there may be an area that we know, like right now, we haven't hit very well out in the Salt Springs area. So we're working on a Salt Springs event. We also haven't hit very well in our southeastern section when you look at Ocklawaha. So we're working on specific events to try to get those individuals vaccinated. But I don't have specific, I have not queried zip code data as a point of reference.
Okay, thank you.
Absolutely.
I have a question.
Okay, go ahead, Nancy.
Do you keep track if there's any variants in our area?
We look, that's a great question. We look at variants. We know we've had some variants, both the UK and the Brazilian. Here's the way that is done. When they run the PCR tests, there's certain spikes in those tests. There's like a 5 or 6 indicator spike. If it spikes out a certain way, that gives them, hey, we need to run this for a variant. And so they'll run it and check. But the numbers we have are just on the ones that have actually spiked out in those particular measures. I know I haven't checked the variant case or variant listing this week, but we did have quite a bit of the UK variant, which we know is covered very well by the vaccines and by the Brazilian, some of the Brazilian variant, which is covered. There again, may not be as good as the UK is covered with our vaccinations, but there is a level of protection that's offered. So we do know that we have variants in Marion County.
Okay,
I don't
thank
get
you.
the specific locational data again. I just get what I'm provided is the number of cases.
Okay.
I was wondering about something there. Do you have any feel for the number of people who will refuse the vaccine in Marion County?
Is that you, Elizabeth? Was that you speaking, Elizabeth?
Yes.
Okay, this is Elizabeth, Mark.
Okay. Not at this time. I've heard as high an average of national in between 35 and 40%. Not uncommon. We saw that with H1N1 back in 08, 09. A lot of vaccine hesitancy up first, and then now you look at H1N1 when those individuals that get their standard flu shot. I think we could probably go along lines and figure after about the first 6 to 8 months, look at our flu vaccination rates and our flu hesitancy and figure go along the lines of that with COVID, because the H1N1 hesitancy, eventually it started off very similar, hesitancy in our medical field. And then now you had a boost in medical field vaccinations. And then you saw it in your general population as well. I think we'll see the same thing with this. There's some COVID hesitancy, probably around 30 to 40%, national. And then we're going to see that hesitancy start to dissipate or decrease as we move forward. I believe it'll follow the same guidelines of H1N1.
Okay, Mark, going along those lines. I don't know, I don't see it in my notes here. I don't know how many residents we have in Marion County, but do you have the percentage of the total number of people compared to our complete population who've had at least one vaccination, one
Yes.
shot?
100. Our complete population is around 365,000.
Okay.
Now, all of that, what I'd probably be better off in providing you, and I could provide this after the fact, is we know we have 139, almost 100, probably 140,000 residents of those 360 that have been vaccinated.
Okay.
I know when we were at the 16 and up until today, that was our total population that qualified for vaccine. We were in the mid 40 range. So about 40% of everyone who qualified for the vaccine had gotten it. It was about 42, 43, might be 44%, somewhere in that range. Now that it drops down to 12 plus, it'll add a couple more age groups. But I actually have that data that I can provide to you all, vaccination by population. I just don't have it with me today, but I can get that. I have vaccination by population. But to answer your question, we've had about 140,000 individuals vaccinated, and we have a total population of 365, 0 and up, or age 1 day and up.
Okay, some people think if the private providers like your PCP, your primary care physician, would speak with you one-on-one about the vaccine,
Right.
that people's hesitancy might be diminished somehow. So other than the really wonderful, your website is just jam-packed full of information. Other than your website, do you have any kind of program or information that goes regularly out to the primary care physicians? What's your relationship with them?
We've been in contact. We've actually worked with, I don't know if any of y'all are familiar with Dr. Kuhn. He's put a lot of information on the website. We've worked with our medical society and other providers to get them registered as COVID-19 vaccinators. There's a specific, It's a short training. And they can now, if they've gone through the training, they can order vaccine specifically for their offices. We actually transferred if a provider came to us and said, look, I can give the COVID-19 vaccination. The biggest problem with the vaccines, and they'll get it worked out as we go down, is multi-dose vials as opposed to a single dose vial, because private providers may not have 5 clients that want that vaccine in a day. So if they puncture a multi-dose vial of Pfizer, then they've got to give it to 4 more within a 5-hour period, or that vaccine gets wasted, or give it to 5 more in a 5-hour period, or they cannot use those vaccines. Once you draw the first dose out of that vial, you have 6 hours to use those doses. And now that's Pfizer, which has a really, really high storage capacity. That was the ultra low freezing capacity.
Right.
And we were fortunate enough, we have a great emergency manager. And when he and I got together, we started talking about this, and he jumped out and ordered us a couple of those units up front. And then the second is the Moderna. If someone's using Moderna, it has a little bit lower storage freezer capability, so you don't have to do the ultra low. But then when you puncture a vial, you have 10 to 11 doses that need to be used. So you potentially, if you have one of your clients that says, hey, I want this vaccine, you got to try to find 9 more to be vaccinated. So that's been the limitations in the private physicians' offices. We've given some, we've gotten some back from them because they're having such difficulties. But you're 100% correct. Private physicians, and it's really going to be the pediatricians as well.
Yeah.
They're the ones that we want talking to these parents, because they're the PCP for that individual. They know that individual best. They have the trust of that individual, and so they could do a good job. And we've tried to work with them on education as well as providing vaccine. The change in the game will be if they can ever get down to single dose vials for whatever vaccine it is. You puncture 1 vial, you take your draw, and you're done. So I think that would be that's going to be somewhere down the road. We'll get to single dose vials.
Okay, and then for me, one final question, and anybody else, Jim Carroll wants to ask a question. This is my final question. We are a bunch of Democrats, and I think we've all done a good job of trying to weed down into the weeds, which we don't want to do. But I just, we all had to take polio vaccines. We all had to take smallpox vaccines. We know that some schools, I believe all schools, require children to be vaccinated for certain illnesses before they will be allowed to register and enter school. So, other than just absolute obstinance on the part of a person who doesn't want to take a vaccine, what in the world? Is it that it didn't kill enough people? I mean, I don't want to get tacky here, but is it that it's not lethal enough? The SARS-CoV-2 virus, is that what it is?
I'm going to get as close to answering or commenting on that as I can.
Okay.
Other than the fact that I am and always have been a proponent of vaccines. In this field, and I've worked enough and I've seen enough damage that was done by misinformation in the late 90s, early 2000s about vaccines, and how it has risen back to increased numbers in our vaccine preventable diseases because of that. There again, it's an individual's with this vaccine, an individual's choice, but certainly, we think of not only protecting yourself, but protecting loved ones and others as well when it comes to becoming vaccinated. And I think that's a major important major importance that we need to emphasize on is you're not only protecting yourself, you're protecting others.
I like that. Okay, we had Jim Carroll who had a question for you. Oh, Jim, we can't hear you.
Can we stop the screen sharing?
Oh, I'm sorry. Okay. I did a good job when we were practicing it, going to stop the screen sharing, but there you go. Sorry about that.
Great job. Okay, Jim Carroll. Jim, you need to unmute yourself. Uh-oh.
Okay. My question is basically yours, Linda. Other than public school kids have to be vaccinated for a whole bunch of stuff, or they can't go to school. So why is it that that vaccinations for COVID cannot be required of everybody, so to speak.
That's to be honest with you, that Jim, that's a question that's above my level of involvement, and I hate to not answer it, but that's just something that's it's certainly something that that could be proposed, but I think right now it's and one of the things that you're looking at is we still are under EUA with this vaccine, but EUA still comes with a lot of safety and security from both the FDA and CDC. You never know down the road. You just don't know.
So the emergency authorization is what you're referring to, right?
Correct. Emergency use authorization. People say, well, it's got an EUA. We don't know. Understand that there's been thousands of tests on these vaccines for both the FDA and the CDC to give approval for use.
Okay. Do we have other questions from the floor? Jim?
Can I ask one more?
Sure.
Regarding senior communities in the county, apparently you don't have data for those. Is that right?
We don't have it by community. We don't. I know we did. They did. Well, actually, that wasn't us. One of our other state entities did that vaccine event out by On Top of the World. We did some vaccine events for some communities at the Florida Horse Park. We're still looking if other communities, now that we've gotten, we really had to focus at first at the mall setting and the brick and mortar schools. That way you maximize as opposed to going into a community not knowing what you're getting. If Oak Run is certainly looking for something, we'd be happy to, now that we have that availability, because we're decreasing that mall site, to coming out and doing a on-site vaccination event, if that's something you'd be interested in.
How much lead time would you need?
I would say let me get through the middle of June so I can get get my school stuff wrapped up. But what would probably happen is, I think it would be better if myself and the emergency manager you want to reach out to me, Gary, by email and set up a time and let me meet whoever your representative out on site in the next 2 weeks. We like to take a look at where we would vaccinate, how it would be set up. And then we would, kind of try to get a feel from y'all on how many you think would want to be vaccinated. Typically, we try to find, if you have what we would do is if you have a center area or a clubhouse or two that we could focus with, work at setting up some chairs, some registration. And we would even do we would even give, if they wanted appointments, we could block appointments and have somebody take the lead through the organization out there and establish we can give appointment times. We want 50 per 30 minutes and fill it that way. That way we don't have people backed up, lines backing up. We could establish it and have people come by lines. But I would say, if you'd like to meet with me in the next 2 weeks, we'd be happy to come out and take a look at the potential areas for vaccination.
Thank you. We'll let you know.
Okay, thank you. Okay, do we have any other questions from the floor? Okay. If there are no other questions, Mark, I want to tell you how much I've appreciated this, and you've just done a great job.
Thank you, Mark.
And we've all been I hope you appreciate we've all been on our best behavior.
I know you have, and you don't know how much I appreciate Marion County and all of our residents. We've done, I mean, I know you look at some of the infections and it doesn't look the greatest, but when you look at the numbers and where those numbers are, we've had a lot of people doing the right thing. Let's put it that way. A lot of people doing the right thing, taking personal responsibility and keeping themselves safe. I appreciate the opportunity to talk. I mean, you think I'd be tired of talking COVID, but eventually I'm going to get good at it. So, but I do appreciate the opportunity. And if you want to reach out to me if you have any other questions, please feel free to provide my email, as well as if you want to set up a time for discussion. I'd love to come out and we can figure out how we could do a vaccination event
That'd be great at Oak Run. Yeah.
Yeah, we'd be happy to set up something out there now that we're.
Thank you very much, guys.
Thank you.
Y'all have a wonderful evening.
Okay,
Thank you, Mark.
Take
Thank
care.
you very much.
Bye-bye.
Bye-bye.
Thank you, Mark.
Yep.
Okay, guys, down to real quick stuff here. Let me get my notes in front of me.
Linda,
Yes, Hal.
I proposed that we had some blank covers that might want to just retouch on the certificate of appreciation.
Oh, okay. All right, we can do that. Guys, for those of you who didn't get in right at 7 o'clock, we honored earlier Wayne Namey, our just recent past president, with a certificate of appreciation because of the wonderful job he did. I'm just gonna hold it up to my, if you can see it.
Yeah.
And because we couldn't be together in person, I'll be delivering this to Wayne tomorrow. And he just was so active in supporting the Democratic Party, our club, organizing events, supporting candidates. And he was just a real go-getter and an inspiration. And we felt he just needed to have something to put on his wall. So that's what we did.
Thank you.
Okay. All right, guys. Okay, where are we here? We have the treasurer's report. We have $800.12 in the bank, and we have 54 paid members. The secretary's report, you can see the YouTube video of our meeting, of all of our meetings. Thanks to Gary. Once again, thanks to Gary for his technical support. Okay, we got to get down to tricks here now. Everybody who's on the meeting, everybody who is actually paid up member, I don't know how many of us, I don't know if there's anybody here can vote on this. If you're not actually, I wanted to thank Dan Lack very much. Let me mention Dan here for a minute. Thank you, Dan, for being here. I hope you enjoyed the presentation, and we like it when you join us.
I did, and thank you to Oak Run for the Ritz donations last month. It was very helpful.
Okay. Well, thank you for being with us. You don't have, you can stay with us, or you please stay, or if you want to go, that's fine too. Okay, I just wanted to recognize you. Okay, thanks. All right, we have our 5 finalists for our slogan competition, and I think Gary's going to do a screen share here. There he is. The short list for the slogan contest. Gary, would you like to just take care of this? I mean, I'll just sit here and be quiet, and you go down the list.
Sure.
Hal will record the votes.
All right, we got 25 total suggestions for a club slogan. The board met earlier this week and reduced it to the short list of 5 of them here. You see on the left side of your screen: democracy for all, equality, empathy, opportunity, for a better society, supporting democracy, integrity and purpose, democracy's guardian. And that they're numbered not to cause you to think that we have any preference one way or the other, but just that as we vote on them, we can just refer to them by number. And I think we're just going to do this by putting hands up on in front of your camera. Everybody's got their camera on, right? So we'll see how this goes. In case we don't get an obvious winner from show of hands, then maybe we will eliminate a couple of them and try again. We'll eliminate which ones we think are the least appropriate and try again.
I want to make sure Hal's ready to record. Are you ready, Hal?
I can no longer see all the screens because we're doing screen share. I can't see everybody.
Oh, okay.
We have 2 screens.
Well, I'll do it. I'm going to record. I'm going to record the hands up. Okay, everybody. Go for it, Gary.
All right, and again, please pay no attention to the number that's been assigned. That is not a mark of preference on anybody's part in the board. So those in favor of number 1, democracy for all, show your hands.
All right, let me make sure I get them up. Oh, okay, I've got 1.
Oh, then Mickey counts twice.
Oh, okay, wait a minute. 1, 2, 3, 4, 5. I have 5 for that one. Number 1 got 5 votes.
Right.
Okay.
Show of hands for number 2, equality, empathy, opportunity.
Okay, I'm
3 hands.
I'm seeing 4 votes.
4 counting yours, Linda.
Yeah. Okay.
For number 3, for a better society. Okay then. Okay, no counting necessary. 4, supporting democracy.
I see one.
Wayne, you got a hand up there?
No,
Oh,
no.
he already voted. I see one vote
Glenn. Okay, there's one for Glenn.
for
And-
supporting democracy.
All right, last one on the list, integrity and purpose, democracy's guardian.
I think we're all out of votes.
Number one
All
got
right.
it. Number one got it.
So Linda, do we get 5 votes for number 1?
5 votes for number 1.
I think that is probably the winner then.
Linda,
Okay.
Yes.
add mine too for Democracy for All. It took time for me to think about them.
Oh, okay. All right. Okay. So now we have 6 for democracy.
Yeah, yeah.
Okay. All right. Okay.
Hey.
We
Okay,
will-
so our acting secretary, Hal Chitwood, he's the one who has the names relative to the shortlisted list of slogans. He'll let us know who the winner is, and that winner will be getting a $20 gift certificate from the club.
I can decode.
And
I
it was
can
fun.
decode
I'm glad to see everybody participating.
I
Okay.
can decode that now.
You can tell us now?
That's Lily Fruit.
Oh, okay. Does everybody know Lily?
Yeah.
Okay. Okay. So it's Lily. We'll have to let her know. Okay, guys. Let me look up. Hang on. Don't leave me yet. Oh, I got one more thing. I need to take an audience survey here, and we're going to do this survey by a show of hands. We've been itching to get together in person, and I don't know if we emphasize this enough. Earlier this afternoon, President Biden stood up on television and in prime time, or in our old folks' prime time, told us we can all go out if we're fully vaccinated and just run around all over the place and just go crazy without our masks on. Okay? So just so you'll know. So we want to get together, and we're thinking of getting together outside because as of our next meeting, not our next meeting, the meeting after the next meeting in September, get together outside for I put BYOD on the email, drinks, because if you want to bring alcohol, that's fine. If you want to bring booze, or you want to bring water, or you want to bring a soda and a snack of your own, and we all get together in some shady place on the Oakland property and have a little social get together in September. Now, what I don't believe we discussed as a board the other day, I doubt if we're going to meet outside that we'll actually have a formal speaker, but I'm sure the board will be discussing that at some point at our next board meeting. So I'm not gonna,
I think we were talking about purely just a social thing.
okay, just a social thing where we get together and we don't even have to have this much on. So we'll be good. Okay, so
Is there anybody who thinks that's a bad idea, or anybody want to comment on it?
now maybe we don't
Just on
even
the
need
concept?
it. Okay, what do you got, Hal?
Well, based on the input you gave us before, what the president said about indoors and outdoor masks, we can go right to the Orchid Club and do it. We don't have to worry about an outside venue.
But sweetie, we don't know if the Orchid Club's going to be open in September. They are doing a phased opening.
Well, I would bet on it.
Yeah.
Okay, well, all right. So, okay, we'll take that up in a board meeting now.
Put in a
Okay.
reservation.
What?
Put in a reservation with the scheduler. You can always cancel it if it doesn't work out.
So we have a regularly scheduled meeting time at the Orchid Club for 2021. But what's stopping us right now is them saying, "Okay, Democrats, you can come on in. The Orchid Club is open to you." You got, I don't know who was speaking. Was it Elizabeth or
No, Sheila.
More Island
Sheila?
Club.
Oh, Sheila. Okay, hi Sheila. Okay.
Yeah.
All right. So we're scheduled. The venues just have to be opened up for us to use them. So basically, yes, Jim.
As some of you know, the Aura and DECA sent out an email saying that they were going to start opening on a slow slow manner, I guess. Did you get an email? And they said that they were contacting all the club presidents or whatever it might be did you get that?
I got the same one you got, and we still don't know when we can meet or what month that will be in. They just said they're going to do a phased in opening, but they're going to, I don't have the email in front of me, but I believe what it read was they'd be contacting the heads of the club or something to that effect. Is that what you remember, Gary?
Yeah, something like that.
Something like that. So we'll get
And that was before today's announcement by the president.
Okay. And
One of the reasons I bring it up is I know the president of the genealogy club has not gotten a message. He was not aware that there were going to be openings. So
It's not the only one, because Irv is in charge of the acoustic jamming, and he didn't get it either.
okay.
oh, okay.
So-
Well, they obviously missed some people's email addresses. So my advice, if you don't have it, you could send me an email. You could send Jim Carroll an email and say, please forward me rather than us take the time and do the emails right now. You'll just contact one of the people. I have received the email. Jim has received the email. Presumably, Gary.
I got it. I'll forward it to the club just so they can see.
Right.
I appreciate that. Okay, so basically, I think we're all okay for September to be in or out together for a social meeting. Am I correct on that?
Yeah.
So we'll record that in a minute. Well, we're being recorded, but Al will write it down as the secretary. Okay, now 2 things. In July, we're gonna have a really interesting speaker, and because he's a professor emeritus of economics from Belmont Abbey University in North Carolina. He lives part-time in Florida and part-time in North Carolina. He'll be in North Carolina in July. We are going to meet by Zoom, okay? Because the professor won't be able to speak to us because he's in North Carolina. So we're going to do that, and it'll be an interesting topic on why income inequality matters. And you'll all be getting a notice of that before that meeting. So then we skip August, and then we go to September, and we have our outdoor get-together. And then we're really happy that we're probably going to get to have our indoor dinner like we always do, always have done in the past in November. And that would be at the Orchid Club, once the Orchid Club opens up and we're all allowed to go in there. And the details will be worked out. You know, we don't know what we're going to have for dinner. Anybody who's been to the dinners though before, they're nice, it's fun, it's a social time. We enjoy ourselves. Okay, looking at my notes here. How about Gary? Can you think of anything I've left out?
I think we got it.
Okay. Well, thank you guys for everybody. I hope you found Mr. Lander's presentation information.
Yeah.
I did. I was very pleased. And
Can I ask a question?
yes,
Can I make a comment?
yes.
I like Gary's suggestion in regard to him bringing the community, the health department to Oak Run, and to reach out to people that might be able to get out in a golf cart and do some vaccinations here at Oak Run. I think that would be a wonderful thing.
Yeah, and we could do it bipartisan. Ooh.
Yeah, almost best if we don't even.
Can we register voters? We're not going to count on them.
Who asked me that? Register voters.
I did.
You did. Okay. Now you know there's training, and there are also legal implications. And I see you laughing. Okay. Anybody who wants to learn how to register voters and participate in a voter registration operation can contact one of our officers for the Marion County DEC. And I've been trained to register voters. I did it one time. It was so much fun. It was on Martin Luther King Day down at the park. What's the name of that park? I never can remember the park, but we went to the big park.
Tuscaloosa or something.
Yeah, and I was running around like a maniac. trying to get people registered. I had a ball. I got there late. I really wish I had gotten there earlier. I would have had more fun. But anyway, you can be trained. There are some legal implications about entities working as a group registering people. So we would want to do this under the umbrella of the Marion County DEC just to avoid any little complications. At least that's the way I feel about it. I think that's what they recommend to us also.
If our objective, though, is to get more people in Oak Run to have a vaccine, then, you know, we should not take any credit for it. We just want to say we spoke to somebody from the health department who's willing to come set this up. And let's not make it a democratic thing necessarily.
Democracy for all. Democracy for
Yeah.
all.
Okay,
Vaccine for all.
who is the incognito person who can get away with that? And you guys know what I'm talking about.
I think you need to just contact Dora, the ORA president,
Okay.
and make it a,
An aura.
they're the ones that control the
You'd have to.
facilities and so forth. And
We can be facilitators, but we don't have to be identified.
And if something has to be open for them to set up in it.
Absolutely. So, Gary, do you want to speak with Mark about it? Do you want me to? Would we like to delegate it to Herman? What would we like to do about that?
Jim, Carol, I will follow up with you, make sure I make the request to the right person here in Oak Run. And then once we've got a go ahead from Oak Run, then we'll coordinate with Mark for a when and the rest of the when and how many.
Okay. And then I just have to make one final comment. Is it not sad, guys, that we can't just say your local Democratic club's gonna have arranged for? Is that not just sad?
It is.
It's sad.
I think that goes along with the flag complaints situations. So I think it's best we don't push that.
No, I'm fine, Jim. I'm just joking. I'm joking around with you.
No, I mean, no, it is
I
sad.
have a little fun here.
It is
Begs
sad.
the question, Linda, it begs the question, would you run down to one that was being put on by the Republican Club?
I will. I don't hate them. I don't hate them. I know they do things. They don't just stick everybody in the back with a knife. They do some nice things.
Such a joker.
I am.
Yeah.
Say that it's, it's sponsored by the Democratic Club. There are people who will think that they were putting some kind of chip in the vaccine.
Oh,
I
yes.
know.
Yes.
I know.
Or maybe it's not really the vaccine, or maybe, who knows what they could come up with in their imagination.
Or it's a fake. It's a fake vaccine.
Right, it's fake.
Water.
It's a vaccine for a fake virus, right?
Okay. Well, we're going to do it the incognito way. We will be facilitators and we will be people to contact by people who aren't afraid to contact us, and we will just move forward. That way, Gary and Jim will talk about it and they will let me know what's going to happen. I want to say thank you to Herman. You worked really hard. And isn't he a nice guy, Herman?
Yeah.
It's not like he was really trying to avoid you at all, He's just a busy man, right?
It's a good
job, Herman.
Yeah, we thought you did a great job for that. Okay,
Good job.
guys,
A lot of emails.
a lot. You really hung in there. I must say your perseverance was admirable. Okay, unless there's any other new business or anything anybody else wants to bring up, I'm ready to adjourn. Oh, I'm sorry, Betty. What would you like?
You're
You
muted,
can
Betty.
unmute yourself.
You're
Muted.
unmute yourself, Betty. Press the space bar.
There you go.
How's that?
Hi, Betty.
Hi. I just wanted to say, as far as talking to anyone about having vaccinations done in Oak Run, you might want to speak to Diane Church, who my understanding, I'm not positive, but my understanding is she looked into that and was turned down.
Is she in charge of the people who do all the good works for the community? It's a club.
Absolutely, absolutely.
So
You
she
know how long
looked
ago?
into it and she was turned down.
That's my understanding, but check with her.
And
She
tell me
might-
what's the name of her club?
Well,
I know her.
Fabrical, no,
Neighbor,
give back to
neighbors
the,
helping neighbors or something like that.
give back to the community.
Get back, okay, so Gary, you want to make contact with Diane?
I know Diane and can do so. Yep.
Okay,
Good.
great.
Well, you know,
She can
just
give-
because they turned it down once doesn't mean we don't try again.
Yeah, let's try.
Hope
Yeah.
Run now
I just-
wants to
She might
get,
give you inside information.
Right.
Yeah.
It's later in the year, and the people now, you know, there's good track record with the vaccines, so
Yeah.
yeah,
Hmm.
they can.
Okay, all right, guys. Well, unless there's any other new business, Wayne, you got anything else? Joe?
Thank you.
Okay, well, I'll see you tomorrow in person,
Okay.
right? Okay. All right, guys.
all
Thank
right,
you.
buddy. Look for
Bye.
the
Thank
YouTube
you.
version.
Bye.
Yeah.
Bye-bye,
Bye-bye.
everybody.